This one is a relatively straightforward scenario. Generally, in each station, you will have 2 or 3 related tasks. In this one, it's just for examination. Your task is that Mr. Wiley is a 65-year-old man who was discharged from hospital 2 months ago after myocardial infarction. He now complains of shortness of breath. Perform a cardiovascular examination and assess cardiac failure signs. Now, to deconstruct the question, you will find inside an elderly gentleman, Mr. Wiley. In the recent medical history, he had myocardial infarction 2 months ago. He must be on similar medications. And he has shortness of breath. Now, you have to think of cardiac causes of shortness of breath and not respiratory. Obviously, there is no history taking for this station. Your task is to perform a cardiovascular examination. Now, within that examination, you have to do a head-to-toe general examination first, and then move on to precordial examination. During both of them, you will look for signs of cardiac failure. Obviously, you start your examinations with greeting, checking patient's ID, taking a consent for examination, explaining what you will be doing, talking about exposure, positioning. In cardiac examination, patient would be on a examination trolley. The backrest would be elevated to 45 degrees, and you will talk about chaperone. In general examination, you will talk about profile of the patient, which means you can say patient looks comfortable, sat up on the bed, or you could say that patient is appearing very breathless and having medications on their bedside or having a mask with oxygen. So that's the profile. Check the pulse first, the rate, rhythm, collapsing pulse. You can mention radioradial or radiofemoral delay. Then you look at patient's hand for all those various signs of cardiac illness like pallor, clubbing, koilonychia, splinter hemorrhage, ossular nodes, Janvey lesions, capillary refill. Move up to the face. Look at the eyes for pallor and icterus, then in the mouth for central cyanosis. Moving slightly down, ask the patient to turn their head to one side, look at the JVP, and then feel the carotid pulse. At this point, you can mention that you will take a blood pressure. While checking JVP, you could palpate liver and try to elicit hepatojugular reflux. Finally, move down to the feet and sacrum and look for any edema there. So these are all the various signs that you have to check on general examination. And then moving on to precordium or systemic examination. First, inspect the precordium. Look at the skin, comment on any scars on the chest or any bulge on the precordium. Then you will palpate. First, palpate for the apex beat, which should be at the 4th intercostal space in the midclavicular line. Then feel for any thrill with your fingertips over the precordium, and then feel for parasternal heave with your ulnar part of your hand on the right parasternal area. Finally, use your stethoscope to listen to the 4 areas of the heart that you should know. Comment on heart sound 1 and heart sound 2. Comment on any murmurs if they are present. Finally, use your stethoscope to auscultate the base of lungs only for any crepitations. You can either do or mention bruit on carotid. So that will complete your cardiovascular examination. Once you have done your general and systemic examination, you can thank the patient, ask them to dress up, and give a closure, and then talk to the examiner.